at 6:55 a.m., the National Emergency Management Agency, NEMA, was alerted through several calls received in the agency emergency call center, and immediately a search and rescue team was deployed to the location along with other response agencies. Persons affected by the blast were evacuated to the various hospitals in the Federal Capital Territory. Thereafter, the Honorable Minister of Interior, the Senator representing the FCT, Senator Philip Aduda, the Controller General of the Civil Defense, and the Controller General of the Federal Fire Service, and myself visited all the hospitals where the victims are currently receiving medical treatment to check on the injured persons and determine how best to attend to them. I must say that the timely evacuation of the injured in the aftermath of the blast has saved several lives. His Excellency, Mr. President, Dr. Goodluck Ebele Jonathan, GCFR, accompanied by the National Security Advisor and Service Chiefs, visited the site of the incidents and some of the hospitals to commensurate with the victims. And His Excellency, Mr. President, has directed the National Emergency Management Agency to collaborate with the Federal Ministry of Health and the hospital management authorities to ensure their speedy recovery. Information available to us this morning indicates that most of the patients had been stabilized and some of them have been discharged. Our information desk is working 24 hours to attend to any complaint or inquiries that family members will have about their loved ones. Appropriate arrangement is also being made by the hospitals and other relevant government agencies for families of those that lost their lives to claim their remains. I wish to therefore use this medium to convey our heartfelt sympathy to families of those that lost their loved ones and assured everyone of the full compliance of the Presidential Directive on the medical treatment of the injured ones. I would like to further call on our fellow citizens to visit the following hospitals and donate blood, which is much needed for the assistance of the wounded persons. Asokoro General Hospital in Asokoro, Maitama District Hospital in Maitama, Wuse General Hospital in Wuse Zone 3, Garki Hospital in Garki, Nyanya General Hospital in Nyanya, and the National Hospital, Nigerian Customs Service Staff Clinic in Karo, Abuja Clinic in Karo, Nasarawa State Medical Center in Mararaba, and then Panraf Hospital in Nyanya Phase 4. Distinguished members of the press, ladies and gentlemen, I would like to call on everyone to be extra vigilant, report all suspicious elements to the security agencies, and render maximum support to every emergency responders. I wish to also express our deepest appreciation to all the emergency response providers that participated in the rescue and evacuation operation, and members of the press for the continued support and collaboration with the National Emergency Management Agency and all relevant agencies in the one-road task of providing timely and effective emergency response. The issue of sensitization, especially when you have emergency situation like the one we had yesterday, it is of a serious concern to us as an agency, and all the agencies are really concerned about crowd control. Therefore, We work with the relevant agencies of government, the National Orientation Agency, to ensure proper sensitization of Nigerians on code of conduct behavior during emergency, when you have emergency, so that crowd control will be minimized. Because unless you are able to control crowd, the responders will hardly have access to the scene of the incidents. We all know what happened during the Dana crash and what we witnessed yesterday. The security agency play a major role in ensuring crowd control, and we will continue to collaborate with the security agencies, National Orientation Agency, Nigerian Civil Defense, to ensure that citizens are properly sensitized on the issue of control in the incident scene. We all know that this incident happened yesterday, and the process of identification of the victim is still going on. Those that can be identified have already been identified. We have their names and the contact numbers of their family, and we are in contact with their families. But we have situations where some cannot be identified. It requires further DNA and what have you. As soon as that is done, we will take appropriate action to contact the family members.